Okay, I think we're ready to go. Thank you, Terry. Thank you for Azette for having me today. Welcome, everyone. My name again is Amie Peel. I am the Trauma Education Coordinator. I am based out of the Trauma Program Office here at UK. Our job is to keep our hospital a trauma level 1 facility and comes that with prevention and education. So this is something true to my heart. So I was grateful to be asked to spend this day with you guys. We're going to address fall prevention. That's what we're discussing today. So as Terry had mentioned, there we go. Whoops, jumped. Little delay. So as Terry had mentioned, there's a lot of falls nationwide. So I've broken this down to just Kentucky, bringing it a little closer to home for us. So in Kentucky, this is the 10 leading causes of injury for inpatient hospitalizations. So if you look at the number one injury, starting as young as 45, falls is what is the number one injury for that age group. But for today's purposes, I'm going to address everybody 65 and older. So you can see there's a significant jump. So for the age group of 65 to 74, 2,500 people have been admitted to UK, or I'm sorry, Kentucky, not just UK. And as the age group goes up, so does the number. So that is a pretty significant number. And we do have ways that we can prevent that. So just some other statistics. 1 out of 4 older people, and again, 65 plus each year, have falls, and many don't even share that with their doctors. So that's one big red flag right there. They're falling at home and they're not having that conversation with their physician. 1 out of every 5 falls causes a serious injury. Broken bones, typically a hip, and head injuries. Frequent falls happen in the bathroom, and there's a lot of hard things in there, sinks, toilets as they're coming out of the shower or the tub. Head injuries are pretty serious. Falls are the most common of the traumatic brain injuries for our elderly. Once you fall once, that doubles your chance that you're going to fall again. So some of it's not even your gait, but it might be your environment. So again, we'll jump into those preventable measures that we can hopefully reduce the fall risk for our elderly parents or family. More than 95% of hip fractures are caused by falling. And interestingly enough, it's a sideways fall. So again, this is where education can come in. It's not walking forward, but it's sidestepping, and we'll get into why people may be doing that and how we can help reduce that sideways fall. That is a repeat. I apologize. Falls are most common cause of traumatic brain injuries. This is a UK healthcare stat. In 2023, UK healthcare saw 1,859 patients that were 65 or older, specifically fall-related injuries. That's roughly 154 a month. That's a staggering number. And then in the state of Kentucky, this is a little older statistic, but in 2020, 31% of older people fell. That's roughly 221,000 people falling. And if there's anything we can do to reduce that number and prevent those injuries and continue with that autonomy and independence for our elderly, that is what our goal is here for today. Top reasons why people fall. You have impaired vision. People have a poor balance or gait. Their chronic conditions come into play, be it Parkinson's, visual, numbness in the legs, but whatever their chronic medical conditions are, medications, and then household hazards. So different things regarding these 5 categories. Overall lower body weakness. If they're starting to slow down and they're not moving around as much as they used to. A lack of vitamin D. That's a simple thing that a physician can give them orally where they can keep their vitamin D level at an appropriate level. Difficulties with walking and balance, if they've been advised to use a cane but still may not be wanting to take that step forward and use that cane. Medications, a lot of antidepressants, a lot of sedatives. People that are older have difficulty sleeping. That will play into what we can do for prevention as well. But those get mixed, those prescription medications get mixed with the over-the-counter medications. So we're going to address what we can do for medications. Visual problems, foot pain, or just overall poor foot health, footwear. Their shoes aren't appropriate. Their shoes, the soles have worn out too much. And then household hazards are if there's uneven or broken steps, throw rugs, clutter, different things in the home. A lot of our elderly male patients are very used to their independence and they aren't used to asking for help. And you always hear, I used to be able to fix that for myself. So certain things may go unfixed in the home that then could lead to a fall that could cause them to then lose more of their autonomy. So we really want to be on top of those things as soon as we possibly can to help them. Now, this is why we're all here today. Let's talk about prevention. What can we do to help prevent our family members or loved ones that are at a risk to fall, and those things that we can help to reduce that potential to fall? So if they're working on their lower body strength, if they're still real active and they're wanting to get out and walk, we want to encourage that. There are many programs. Silver Sneakers will pay for gym memberships. Malls open up and let the elderly walk inside. And there's a lot of benefits to going into the mall and to a gym facility versus the neighborhood. I know people love to get outside and be outdoors. However, what we need to watch for is it evening? Is it dusk? How is the lighting? Are the sidewalks uneven? Are there tree roots that are popping up? Is it fall, the season, where leaves have fallen off the tree and they may be slick if they've gotten water or a little icy? So those are things we want to be careful with when they're walking. Also with walking, a lot of our elderly people have transitional glasses, so their bifocals will be in the bottom of their actual glasses. We really encourage our elderly people to get a second pair without that transition in them. So when they are walking distance, it doesn't distort if it's further or closer away from them. And we also encourage them to get a pair of sunglasses that are prescription without the transition so that they can be out walking, be able to see as well as they possibly can without squinting or without that transition. As I mentioned, the mall and gyms, the other perk to that is usually there's a buddy system. You're not walking alone, or at least there's other people around, so that if there is a fall, they're not left for an undetermined amount of time before someone finds them. So those are the other benefits to getting them into a facility or into a mall without them losing their autonomy. They're still able to drive themselves there. Wearing shoes to make sure they have a steady, sturdy sole on the bottom of their shoe and that it's not worn down. We've heard a lot. This is my favorite pair of walking shoes. And you can tell they've put a lot of miles on them, and I'm sure they're broken in beautifully, but they've gotten slick on the bottom. So just traction. Some things that they start to fall, they may have been able to catch themselves, but their shoes just aren't what they should be. On a side note, with just exercise in general, if the patient is more mobile and they're actually traveling, we always want to encourage them to use handrails if they're jumping on and off a train, a subway, a walkway, the speed walk in the airport, anything like that. We want to caution them about parking lots and curbs. Not all of them are painted well. Where the incline comes down to allow wheelchair access, that's a place that a lot of people hit right on the curb at a wrong angle and will fall. And when crossing the street, A lot of things happen with a feeling of sense of urgency. So they're trying to get across the street as quickly as possible. So if you're walking with them and they have a median halfway through a crosswalk, stop, wait for the next light cycle. So we just want them to not have that sense of urgency and rushing, because when they start to hurry, excuse me, when they get in that frame of mind of they have to hustle, that's when a lot of risk happen. So we definitely want to avoid that. At home, things we want to talk about at home. Do they have to walk around furniture? How is their room arranged? Is there something in the middle that could be changed around so they can have a direct path from their bedroom to the bathroom, or from their living room to the bathroom? So if they are having a sense of urgency, they're not having to maneuver and have that sideways step trying to get somewhere in a hurry. So simply moving furniture out of the way. Throw rugs, that's a very common thing for our older generation. If they're non-skid, where they have double-sided tape so that they won't slide, that's better. But if they're willing to just let them go, that would be ideal, because that a lot of people get them tangled up and then that causes them to lose their balance. A lot of older people hang on to things. You know, they are the generation where you appreciate and just don't throw away. That's being wasteful. So with that comes piles of magazines or newspapers. Often you'll see them on one of the steps going up and down to a bedroom or to a basement. Definitely want to clean those things up, because again, as they're coming down and they hit that, that's going to create a fall risk. Lamps, wires, extension cords, how are those managed in the home so that those don't become a tripping hazard? Keeping the stairwells clean. And as I mentioned earlier, if there's a loose step or something that might need to be repaired, addressing that. Lighting in a stairwell or a hallway. How well is the lighting? Do bulbs need to be switched out and become LED so it's brighter, because their vision isn't what it used to be, but really illuminating that hallway or that stairwell so that they can see that step. If it's a darker stairwell going into a basement, if there's any way to mark the edge of the step with something either reflective or just color so that it's able to stand out. And are there light switches on each side of the stairwell? Sometimes people have to turn them off on the bottom level and then walk up before they leave. It would be worth it to have an electrician come in and just add an extra light switch at the top. It'd be far less expensive than them risk falling, having a horrible injury, and then a hospitalization on top of that. So an electrician, that's not too unreasonable to ask to have somebody do that. When we're talking about lighting also in the bedroom, same thing. Is there a lamp on their nightstand table so that if they need to get up in the middle of the night for anything, go to the restroom, go to the kitchen, to turn a light on so that they don't have to go to a light switch? Again, they're not crossing that dark area and have lighting that's available for them. In the kitchen, I've rounded the corner and I found my 75-year-old mom up on a stool, a 3-legged stool, not a sturdy bench by any means, because she kept certain things on the top shelf. So immediately I brought things down to her level. I removed the stool. I was like, it's time to move it down. I know that's where it's always been, but I just wouldn't want her on a stool when I'm not there, because she lived alone. And is the step stool unsteady? They now have the 2-step stool that comes out in a tripod, and it's more like stairs, not a ladder, and sturdy. So if that's something we need to grab at Walmart or Target or Costco to get them something that's not a bar stool, not something that spins, not something that's not stable. We can look into our bathrooms. If you look into the bathroom, a lot of falls happen in the restroom. Elderly people, as we all are, modest, autonomy, independence. You don't want someone in the restroom with you. None of us would. So being empathetic to their feelings is very important. But what can we do to make their bathroom safer? You can install a support bar. Those are very easy to install. I say that because I've done it myself, so I'm not handy. If I can do it, it's pretty easy to be done. And then the floor in the tub, it's very slippery. So is there a skid-proof mat? Is it the tape that you can put on the bottom of the shower so it doesn't move and they don't remove it to clean it and then not put it back down? Do we need to put those on the floor? Do we need a non-skid rug on the floor? Because again, a lot of falls unfortunately happen in the restroom. And when they're coming out of the shower, the sink and the toilet are very hard items that lead to some of those traumatic brain injuries that people have experienced when they fall. Trying to think if there's anything else. The bedroom and the bathroom is where they tend to spend a lot of time, living room and kitchens. So again, I reiterate, if we can just look at lighting, look at throw rugs, look at stacks of clutter, look at any way to clear the path to help make it easier for them to continue to move around in their own home. Other things that we can do is encourage them to talk to their physician. Many falls go unreported. They don't want to tell their doctor. They don't want somebody to tell them they're not going to be able to live on their own anymore. And really, we need to change that to, we're trying to help you stay independent. So you can talk to your doctor or your pharmacist and have a medication review. Medications are constantly being changed. Anything new they may be taking over the counter. So they can discuss that and say, this would be a better time to take at night, but it may cause you to be drowsy. So again, reinforcing a strategy if you have to get up in the middle of the night to go to the restroom. Having your eyes checked. We have patients that come in that have had the same glasses for 5 years. So if they can just have an eye check and get updated glasses annually, and then while they're there, reinforce, let's get one pair that's not transitional. So if you are outside or you're walking, or even if they're not walking for exercise, but you're taking them shopping or to the grocery store, they don't have that transitional lens to confuse where their next step may be. Wearing shoes both inside and outside, avoiding the barefoot and the slippery shoes, slowing down. We all tend to walk our own pace, but when we're walking with our loved ones that are older, we need to be aware of our pace and walk their pace so they don't feel that they're rushed or hurried. The other main thing that we can think of is the exercise. There's so many programs available for the elderly. At the end of this presentation, I'll have a resource page that's got some basic flyers and other contact information, but there's Tai Chi, there's silver sneakers, there's many programs designed where they're going to be exercising at their pace with their peers. It's a way to stay social, but it's a way for them not to feel uncomfortable that they're going to be with their peer group while they're doing that exercise. Other safety tips that we can do when we leave our loved ones and they're still being independent, we can put emergency phone numbers with a large print them out on the fridge, print them out in their bathroom, print them out in their bedroom. In my mother's room on the mirror, I had my phone number and other numbers taped in a large print that if she didn't have her glasses on or had fallen and lost her glasses, that she'd still be able to see those numbers to call. She actually still had a landline when my mother fell, and she actually got a hold of the cord and pulled it down to her. So from that point forward, I started leaving a phone on the floor. We left one on the floor. That way, if she fell, if she could at least scoot, she lived by herself and we didn't want her to be down too long alone. So we've put a phone near the floor or just on a really low stool at ground level. We kept those emergency numbers in large print. And we encourage the people, if they are willing to wear the Alert Life necklace while they're at home. A lot will not. Hers was usually on the nightstand by the telephone. But if we could get her to wear it, I just told her when you're at home alone, no one's going to see it. You can set it right inside your blouse. But that way, just gosh forbid, if she needed it, she had it available to her. So those are all some things that we can do to prevent a fall. Again, that side step, moving furniture, that's where a lot of hip fractures come from. And that's one of the motions we can prevent in our elderly population. This is a fall risk screener. This is for the patient to fill out themselves. And this is just a self-awareness because we can educate our loved ones. But my mother, as she told me many times, she was the mother. She brought me into this world. She raised me, and she did not really appreciate the role reversal of me being more motherly to her. So I left this fall risk screener with her and just said, Mom, I want you to think about it. I want you to talk to your doctor about it because I will be coming down and I will be taking you to see the physician. We're going to start getting checked a little more regularly. But these are things I want you to think about. So they can do yes or no and come up with a total themselves. And they, do it in the privacy of their own home. Because there's questions like, I am worried about falling, and an awareness. I need to push my hands to stand. I need to push with my hands to stand up from a chair. I'm having a trouble stepping down off that curb. So it just kind of brought awareness to her that that's just a natural part of the aging process. And what can she do? And that lack of being able to stand up independently without using her hands is showing that there is some leg weakness. And that is a direct correlation for why people fall. So having to use a cane, having to use your hands, having to use any kind of assisted device is saying that her legs are getting weak. So that's when I offered to just go for a walk with her. And what could we do to increase her mobility if they're able to increase their mobility? So this is just a screen that I left behind for her. We did not talk about it again. We did not fret about it, but I just asked her if she wanted to fill it out, that I would step out and her doctor could speak about it in privacy where I wouldn't be in the room, and that she could have that conversation without feeling like I was being more of a mother than she was to me. And then my last slide is 3 resources. A lot of what I've shared today came off of them. These 3 particular resources are very short and sweet. They're bullet point. They're the screen, fall screen I had posted is on one of these links, and super easy, just a quick check off link. So you can kind of see what to do. And again, being able to print it off and leave it with your loved ones and giving them the independence to start engaging and making some of those changes. What I would like to finish with is it's very difficult when someone falls. I've experienced that. I have been a trauma nurse for 29 years, and you learn real quick you can't prevent everything. You cannot be there every moment. And you can't feel guilty about it. Guilt is a wasted emotion. Guilt is only warranted is if you're doing something malice. And I don't believe any of us that care for our loved ones are doing anything malice. So guilt is a wasted emotion. I can't say that enough. I struggled with that with my mom. She wanted to stay home. She did experience a fall. So talking to them, making a game plan. I told her she made a fire escape plan for me when I was little. So I wanted to make a fall escape plan for her now that she's older. And having that in place and just leaving it open for conversation, not pushing too much, but revisiting it frequently, giving them the time to process it. Aging is frustrating when you lose your independence and your autonomy. No one wants to give that up. So just giving them the time and doing the due diligence of expressing your concern, that it's out of love, and that you just want what's best for them and how can they help themselves, it would be my best way to have that conversation with your family. So Terry and Azetta, if it's okay, if this is a good time, we can open up to questions.
Amie, I couldn't agree with you more with what you said about, you can't watch over them all the time.
No.
And that guilt thing can eat you alive. And as you said, if you do your due diligence and you talk to them and try to keep that conversation going, things could happen. And, beating yourself up over it with guilt, I should have done this, I should have been there, I should have gotten this, isn't going to do anybody any good. So
No,
yeah.
because you can actually be in the house with them. You
Yeah.
have to sleep. You yourself have to go to the restroom. You could be
Yeah.
standing right in front of them and a fall can happen and you can't prevent it. It's
Right.
not 100% foolproof. We can do measures and try to make it less likely and hopefully drop down that statistic in 1 in 4 people that fall, but it's not preventable 100%. We just have to do the best we can.
Yeah. Agreed. Yeah. Hey, do you have any recommendations for medic alert systems that folks might want to use?
You know, I don't have a particular because it depends on the area that they live. I've learned this from 12 years of case management here at UK. Our catchment area goes all the way to West Virginia, Virginia, and down into Tennessee. So it really depends on the service area. The best thing to do is to check and see what's a strong signal and works well in your particular area. Because one brand's not better than the other. Most fail because the patient doesn't want to wear it or your loved one doesn't want to wear it. But if it has a good reputation and this is what I tell most families, ask someone that has one in your area. Do they like it or not? Have they been successful with it or not? Because recommendations from family, church members, loved ones, neighbors, that's invaluable right there because it's in the service area as your loved one, and that's going to give you the best know-how on which product to go with.
Yeah, yeah, that's good. And can you please send out a copy of that fall risk screener for folks to maybe leave on the table with their loved one? I can use that. I can put that as an attachment into the email I'll send out with everybody.
Absolutely, Terry. I will send that one separate to you as a PDF so you can attach it.
Yeah, that'd be great. That'd be great.
Absolutely.
Does anybody else have any questions for Amie or comments? Personal experiences? No? Okay. All right.